In recent years, the prevalence of depression in China has surged, now rivaling conditions like cardiovascular diseases, diabetes, and cerebrovascular diseases in terms of patient numbers. The toll of mental disorder distress stemming from depression profoundly impacts both the physical and psychological well-being of sufferers. Such distress often leads to suicidal ideation, with approximately 280,000 suicides occurring annually in China, with 40% linked to depression. Disturbingly, certain manifestations of depression can emerge in adolescence, often escaping detection. Despite its prevalence, depression remains shrouded in misconceptions, leaving those afflicted grappling with feelings of shame, a dearth of education about the illness, and formidable barriers to accessing treatment. In this edition of the Ningdian interview, we sit down with Xian, the Secretary General of the Beijing Shangshan Foundation, to glean insights from over a decade of the Foundation's work in mental health prevention and patient support. This conversation aims to cast a beacon of hope upon individuals wrestling with depression, illuminating pathways to understanding and healing. Established in 2012, the Beijing Shangshan Foundation stands as a pioneering force in China's philanthropic landscape, dedicated exclusively to mental health advocacy, depression prevention, and knowledge dissemination. In April 2013, the foundation took a proactive step by compiling and disseminating the Promote Mental Well-Being, Awareness Manual of Depression through a unique book drifting initiative, making vital information accessible to the public at no cost. In 2014, the foundation launched the 1 Hour of Listening campaign in multiple cities. Since 2015, it has annually awarded the Shangshan Public Welfare Promotion Award to commend outstanding media contributions to mental health awareness. The foundation focuses on promoting mental health practices through professional, objective, in-depth, and innovative means. From 2018 to 2019, the foundation conducted over 1,000 activities, serving nearly 100,000 depressed patients, collaborating with 94 organizations, and distributing 114,000 depression awareness manuals. The Shangshan Foundation, along with numerous non-governmental anti-depression organizations nationwide, collaboratively initiated the Defeat Depression Public Welfare Project in 2018. This ambitious endeavor aims to establish a comprehensive social support network for the 90 million individuals affected by depression in China. Over 3 years, the project has garnered participation from over 30 civil organizations, facilitating thousands of offline public welfare activities. In March 2021, a groundbreaking event unfolded as the Shangshan Foundation, the Chinese Mental Health Association, and the International Bipolar Disorder Society China branch jointly launched the Run for Life. This unprecedented event marked a significant milestone, uniting healthcare professional associations, mental health public welfare institutions, social organizations, mainstream media, compassionate enterprises, and the general public. Through collective engagement, this initiative signifies a pivotal step towards advancing depression prevention and treatment, while fostering the development of a robust social support infrastructure. The Foundation's development trajectory closely mirrors society's evolving understanding of depression prevention and treatment, delineated into 3 distinct stages. The first phase commenced approximately 12 years ago, during the Foundation's inception. At this nascent stage, the primary focus was on science popularization. The Foundation endeavored to enhance public awareness of depression through initiatives such as campus book drifting and expert-led salon lectures. Additionally, it provided financial support to students from esteemed institutions to conduct scientific research aimed at advancing depression prevention and treatment methods. The second phase unfolded roughly 5 to 6 years after the Foundation's establishment, spanning from around 2018 to 2019. Recognizing the limitations of science popularization alone, the Foundation intensified efforts to support and intervene with individuals affected by depression. Consequently, the Foundation spearheaded a collective grassroots anti-depression movement, forging alliances with partners who had demonstrated exceptional dedication to this cause. Together, It pooled resources, explored innovative approaches, and extended various forms of support to patients with depression and their families. The third phase, spanning from 2019 to the present, has been marked by rapid advancements in Internet and AI technology. Leveraging these cutting-edge tools, the Foundation adapted its approach by developing platforms through mini-programs and other digital means. This shift in strategy has enabled it to amplify its advocacy efforts and reach a broader audience. Recognizing the Foundation's role as a private philanthropic organization rather than a professional medical or scientific research institution, its focus has shifted towards advocacy. The Foundation aligns its work with Healthy China's strategy, advocating for prevention through various channels. It aims to empower individuals to take ownership of their physical and mental well-being. Given the significant prevalence of depression in China, particularly among younger demographics, prevention has become a paramount focus. The Foundation prioritizes preventive measures to stem the tide of new cases and safeguard the mental health of communities. Viewed from the perspective of onset, depression is a psychiatric syndrome, encompassing various emotional states, with key symptoms including cognitive slowing, mental inhibition, and mood disturbances. Similar to physical ailments, they may not resolve independently and require treatment through scientific methods. Xin said that in her work with the Foundation, she has observed a positive shift in society's understanding and attitude toward mental illness. When she was in school and mentioned studying psychology, reactions were often marked by shock and mystification. However, nowadays, when she discusses career paths or majors, it's evident that societal awareness of mental illness has significantly improved. Despite some improvement, there's still much ground to cover. Firstly, the pace of cognitive advancement regarding depression remains disappointingly slow. Secondly, a significant portion of the population still conflates depression with transient sadness. While occasional low moods are common, clinical depression represents a deeper and more persistent struggle. It's crucial to recognize that untreated depression can profoundly impact daily life, potentially escalating into a chronic condition if not addressed promptly. Patients with depression often struggle to regulate their mood due to abnormalities in neurotransmitter secretion in the brain, leading to a loss of the ability to experience happiness. While some individuals may be more susceptible to depression, it's essential to understand that depression arises from a complex interplay of internal and external factors, rather than being solely attributed to personality traits. Unfortunately, there remains a stigma surrounding seeking help for depression, with many feeling ashamed to consult a psychiatrist. However, depression is a legitimate medical condition that requires professional intervention. Just as one seeks medical attention for a physical ailment like a cold, it's equally important to seek help for depression. Furthermore, the misconception that relaxation alone can cure depression is akin to expecting a broken bone to heal without proper medical attention. Patients with depression often have disrupted neurotransmitter function and require medication to rebalance brain chemistry. The Foundation dedicated significant efforts to disseminating scientific knowledge about depression. It's crucial to recognize that depression is a complex disease that affects both the body and mind, manifesting in physiological changes and physical symptoms. Unfortunately, despite its efforts, there are still discordant voices in society, perpetuating harmful misconceptions about depression. For instance, some label it as a lazy disease or dismiss it as something that one should simply snap out of. These attitudes contribute to a pervasive sense of stigma among those suffering from depression. To illustrate the impact of stigma, the Foundation shared an example from its Huixin project, aimed at supporting depressed teenagers from financially disadvantaged families. During implementation, the Foundation encountered a concerning trend in the field of mental health. Feedback from visits to specialized hospitals revealed that some patients preferred to seek treatment at general hospitals rather than specialized ones. Their reasoning? They felt that by visiting a general hospital, they could avoid others knowing about their condition, thus shielding themselves from potential stigma. In the next episode of Ningdian Interview, Xin the Secretary General of the Beijing Shangshan Foundation, will share insights on how to support people with depression.